The broadcast is now starting. All attendees are in listen-only mode.
Hey everybody, thank you and welcome to today's Health IT webinar hosted by Patagonia Health. Today we're going to be covering the webinar topic about protecting patient data and preventing security breaches. My name is Amanda Gerard and I'm going to be your moderator for today. If you are not familiar with the GoToWebinar platform, please look out for the communications box directly located on the right side of your screen. All of the attendees will be muted throughout the presentation, so the presentation box is your way of letting us know if you have a question. The little red arrow that's up in the corner of the box is going to allow you to shrink or expand that box as necessary so that you can view your full screen. The red arrow will remain in view even when the box is shrunken. Now, if you have any questions at all during the presentation, please do enter those into the questions area here in this box. We will address each one of those at the end. There will also be some poll questions popping up, and we ask that you please take the time to answer those quick questions when they appear. Today, our presenter is Srini Kolathur. Srini is joining us from Databrackets, where he is the president of a company that assists in organizations in developing and implementing practices to secure sensitive data and comply with regulatory requirements. And today, Srini is going to take his expert knowledge and talk to us about protecting patient data and preventing security breaches. Now I'm going to take the time to turn the presentation over to Srini, but I will be back with all of you at the end of the presentation to address your questions, so please do stay on for those questions at the end, and just give me one moment while I switch over the screen to Srini.
Awesome. Thanks, Amanda. Thanks for giving us an opportunity to be able to present about the most important topic of the day, which is protecting data and preventing data breaches. This is on everyone's mind, pretty much. If you talk about it, or like if you talk to your colleagues, or if you open your newspaper or listen to news article like ransomware and the whole big issues like nation actors, making the data stealing is like kind of a business now. And this is a big deal. Definitely, we are going to share some of the best practices and the reminders, tips, and tricks for how to protect the sensitive data that most of the healthcare organizations are handling these days. Before we get started, a couple of things. This is from our attorneys. So this webinar is being provided for educational and information purposes only. So don't construe this as like a legal advice or anything of that sort. And if you have any specific situation like a data breach or whatnot, please consult your attorneys. This is a little bit about Databrackets. So as Amanda mentioned, we are into security and risk assessment, regulatory compliance assessments, and the whole 9 yard that comes with the certification and whatnots with the data security. So the way we do it is like we have our own DIY toolkit. We use that for our consulting engagement, and also we offer that to our customers if they are interested in doing it themselves. And of course, we have our own consulting group that does security assessment, anything related to the MIPS, MACRA program, security risk assessment, and whatnots. And of course, like you can completely outsource your entire compliance headache to us, and our experienced people will take care of the monthly, the quarterly, and the annual requirements with respect to different compliance requirements, and you can run your business. So these are like some of the high-level services that we offer. Of course, we started off with HIPAA and HITECH, and then like we expanded our services into different areas, including OSHA, CFR Part 11 if you are into pharmaceutical areas, and then a lot of standards are published by NIST, and like we do several assessment based off NIST framework, and any of your vendor security risk assessment and your credit card security if you're handling European Union consumer data, then like GDPR comes into play. And then, of course, we do ISO 27000 certification as well. So that's along the that's around like the security and the compliance side of things. And then, yeah, as you could see, like we have several services that are offered. One of the things that we wanted to mention is a lot of the folks who are on the call today, you might be testing for MIPS and MACRA programs. So if you see the MIPS MACRA program, apart from the reports that you generate from your EHR systems, you also need to attest that you have completed your annual security risk assessment. So that is something we do a lot in this space. And some of our customers got audited after our assessments, and some of them got audited even before they did any assessment. So we've been reached out by them. So we can help you out with respect to any of the security risk assessment requirements with respect to MIPS MACRA programs and stuff. So I think Amanda already covered the logistics of the webinar, and so just a little bit about myself. I will let you go through that. And there are a lot of terms you'll be hearing today. I didn't mean to sound very technical or very intelligent. Just these are the terms that are widely used in the industry. PHI stands for Protected Health Information. It's not patient health information or personal health information. HHS, of course, Health and Human Services. That is the agency responsible for making sure all the patient data and the patient rights are enforced. OCR is the enforcement wing of HHS, called Office for Civil Rights, and they are OCR auditors are the one auditing a lot of these different healthcare organizations and others with respect to the different regulatory requirements. GDPR, I think we talked about it. It's the privacy law for the European Union, and HIPAA, of course, like most of you must be familiar with HIPAA by now. So just a 10,000 feet overview in terms of why you need to care about protecting your patient data. I don't think I need to spend a lot of time on this one. You all know the importance of it. That's why you're attending this webinar. So there's a lot of identity theft that's going on. So people are able to steal the information from your organization, and then they are able to use that information for financial gain, primarily with the reimbursements and other things. Of course, a lot of these issues are happening via the malwares that are, being injected by this malwares and the ransomware things. So definitely we will discuss that in detail in a little bit. Why do you need to even protect the data? So as we discussed earlier, HIPAA and HITECH has a very specific requirement that like you need to comply. If you start taking data from your patients, and if you are providing medical care to them, then you need to follow the guidelines provided by HIPAA, HITECH. And then, of course, there are a lot of other state privacy rules, and the state HIPAA rules also kicks in if you are handling patient data. And whichever rule is, higher, meaning like it's more stringent, that kicks in. Let's say you have a federal law and you have a state law, and you have a much stringent state rule. Then the state rule kicks in. So definitely you need to understand if there are any specific state-specific requirements with respect to HIPAA, HITECH in your state of business, and then make sure that like you are complying with those requirements as well. So of course the penalties, monetary penalties. If you have been watching the HHS newsletter, so they at least announce 1 to 2 settlement cases every month based on our at least analysis. So the settlement numbers could range from maybe $50,000 all the way to millions of dollars, depending on the severity of the issues, depending on the number of records that are breached and other calculation that they have. So, but this is real. Penalties are becoming more and more now. In fact, on the OCR unit of HHS, they are hiring a lot of auditors to make sure that they are able to address all the complaints that they are getting from patients and other agencies. Of course, there are civil and criminal liabilities also if we are not able to follow some of the requirements that are outlined in the HIPAA HITECH. And so the last one is, of course, nobody wants to lose the trust of their customers, and especially when it comes to data protection now. Most of your customers are taking it very seriously. They want to make sure that whatever data that they are storing on your premises or with your business is all protected. So the main thing about the HIPAA HITECH is like it's kind of there are three sections to it. One is the privacy, especially about the confidentiality of the information, that a particular patient's information is shared only with the authorized people, not like, say, for example, the billing, the provider, and anybody who is providing care to that patient. And then this particular information is not shared with any marketing team or pharmaceutical group and whatnot, right? So that's where the privacy rule kicks in. The security is especially when a provider or a clinic or an organization converts the whole data into electronic format, which is what's happening in most of the places now, then the security rule kicks in. So any form of electronic version of the patient data is considered coming under the security rule. So essentially what it means is HIPAA has outlined very clearly in terms of what needs to be done with respect to the security requirements or meeting the security requirements. So that's where the security rule comes in. And then the breach is you do all the privacy protection, you do all the security protection, still a data breach happens. So what do you do with respect to data breach? When do you notify, and who do you notify, and what is the remediation steps and other things that you have? So the penalties slide that I have here is like to just kind of give you an idea of when does the penalty clause kicks in. So anytime when you violate this privacy, security, or breach, then the penalty rule kicks in. So I have a separate slide in terms of the penalty amount and other details and the categories. So apart from HIPAA HITECH, right? So we are not generally talking about HIPAA HITECH today. So it's about generally protecting your patient data and how to prevent data breaches. So there are a lot of other rules, numerous other regulations, right? Like including GDPR, which we see in the market. Like a lot of our customers are increasingly trying to comply with the GDPR requirement, which is for the European consumers. So that GDPR provides basically it provides a lot of rights to the data holders. Say, for example, the consumers, right? They have the rights to delete the data that is that an organization is processing. They have the rights to know where the organization has shared their data with. Pretty much it expands the HIPAA form of requirements into the entire gamut, right? So meaning like it's not restricted only to the healthcare industry. GDPR is pretty much focused on sensitive data, but across the board. So that's how the GDPR is kind of defined. But then it is primarily applicable for the European consumers only. So there is no nationwide law within the US for the consumer data protection, or at least not as stringent as GDPR. So that's one important thing that you need to be aware of. And then the next one is the New York Data Privacy Regulation. Again, this is mostly for the financial industries. I'm not sure like the folks who are on the call had to comply with this New York cybersecurity regulations or not. But again, the California Consumer Privacy Act, some of you might have to comply with that depending on where you do business, or if you are handling California resident data, then you need to comply with the California Privacy Act. If you want to learn more about some of these other requirements that are listed here, we do offer separate webinars as well. You can go to databrackets.com and you can look at some of our past webinars if you want to learn more about some of these things. And again, as I said, like if you are handling credit card within your practice, I'm pretty sure like most of you are handling it. So for payments and other purposes, then you need to comply with the PCI DSS. DSS stands for Data Security Standard, Payment Card Industry Data Security Standard. So that is something actually you all need to comply with it. And again, like you are collecting sensitive data there, the credit card information, the CVV number, and other details that are associated with the credit card. So these are like some of the things that you need to keep in mind. So let's switch gear and focus on the health information that we are talking about, the sensitive data. So the one that you see, the box that you see on your left side, which has 18 identifiers that are provided in your HIPAA language, right? So these are the 18 data elements that they consider as sensitive. And then anytime this information combined with that particular individual's medical records or the claim detail or the payment or whatever information that's on the right side of your screen, when these two are combined, that means you can identify somebody with a specific condition or specific detail about their treatments and whatnots, right? So then it becomes PHI. So that is when the HIPAA rule kicks in. So HIPAA rule kicks in for the PHI data only, right? So you need to, so if you have list of patient information and you don't have anything else, then it's very questionable whether it comes under the HIPAA rule or not, right? But when you have some information about the patient and again with some of their conditions and whatnot, then the HIPAA rule kicks in. So this is just to give you an understanding of what we are talking about here, what is sensitive data and stuff, right? Just the name alone, just the address alone, or just the date alone, date of birth alone is not going to be an issue. When the combination of some of these things along with the medical information that is listed here on the right side of your screen is when it becomes PHI or like more sensitive, and that is when like you need to make sure that you are providing all the security best practices in order to handle this data, right? So this is the thing that we talked about, the violation, what kind of penalties are in place. This is per record, right? So $100 per record. Let's say like you are a practice managing about 10,000 patients, and where like you stored all this information on a laptop, that laptop is missing, then you need to estimate what is the potential penalty amount, right? So one way to mitigate this one is a lot of our customers, we are advising them to have cybersecurity insurance. So that kind of covers any kind of incidents that you may have during your operation, day-to-day operations and stuff. But having said that, the insurance alone is not going to cover you, legally and also financially, because like the insurance company requires you to conduct your annual security risk assessment, and they want you to implement all the security best practices. Without that, their coverage is also questionable, right? So that's why like you wanted to make sure that like you have all the the security best practices implemented, and also worst case scenario in case if things happen no matter what, like whether it's like the federal agencies or defense agencies, like which are very highly protected, and even data breaches happen there. So what do you do in case of data breach and things like that's how like you cover with your insurance, the cybersecurity insurance and other things. So there are a lot of sources if you want to learn more about what is happening in the industry, what kind of data is being breached, and the sources of the data breach and stuff. So Data Loss DB, Privacy Rights Clearinghouse, and even HHS, they have a very nice portal where they publish all the reported data breaches by the individual entity. So just to let you know, if there is any data breach within your organization, especially with respect to patient data, and if it crosses more than 500, then you need to notify HHS within 60 days from the date of discovery of your data breach. So that's what the HIPAA rule says. If it is less than 500, then you have up to the end of the year to report the data breach with the details and things. And also some of the state have much stringent requirements like California, Massachusetts, and Texas and stuff. So obviously depending on the state of your business, you want to figure out what is the data breach requirement, notification requirement, and then be able to meet those requirements as well. So now we are going to shift gear and talk about, how to protect data. All right. So I'm again going to cover just at the conceptual level in the next two slides in terms of what is that we are talking about. So whenever they talk about protecting patient data, there's three things. One is the confidentiality of the data, and then the integrity of the data, and then also the availability of the data. These are the three core pillars of any information security program, right? So confidentiality, as it says, like limiting the information access to only the authorized people, right? So for example, the front desk people, they don't need to know about the specific condition of the patient who is coming in, right? So they don't need to have access to the notes. They don't need to have access to some of the other sensitive information about the patient. That's just an example. And then integrity is whether all the information that is being handled by your organization is being updated by the right people, or like only the right people have access to update that information. For example, going back to our earlier example, the front desk people, they not only should not have access to data to view and also to update that information, right? So only the right people should have the right access to update the information. And then the availability, as you could imagine, it's like very, very critical in the healthcare industry, especially. So the information should be available. Say, for example, if someone has emergency, they're going to the hospital and they want to reach out to the primary care provider to understand about the patient's past conditions and stuff. Obviously, they need to have, you need to have the availability of that information all the time. So that is at the very high conceptual level. And then again, when you translate that into this electronic form of storing data, there are three places essentially, that you need to focus on. One is when you're transmitting the data, that's like, whether through internet or your internal systems or wireless devices and stuff. So that's that's one area that you need to focus, whether you are having all the good practices to transmit the data securely. And then the second one is resting, data at rest. Essentially, resting is anywhere the data is stored. So what essentially it means is any kind of device, whether it's your flash drive or your hard drive on your laptop or desktop, or any kind of disk, portable disk that you use and stuff, CDs, DVDs, when it contains this patient data, then you need to implement appropriate mechanism to protect that information. And then the last one is data in use. Part of section because they think that the data is not stored there. That's totally wrong, and there are a lot of use cases where people did not have appropriate protection mechanism for the elements in the data in use category, so they ended up in trouble. Say, for example, your fax machine, your copier machine, or like your memory, like when you're disposing of your laptops and stuff, all of them store data. And if you're not sanitizing the data before disposing it off, or before properly getting rid of those devices, then you are going to be in trouble as well. So that's why data in use is also very important as you're planning on implementing the security best practices and things. So what I did is like I kind of put together about 11 security best practices that you could use in order to protect the sensitive information, right? So let's go one by one, and I promise like I won't take too much time. And again, I'm going to be sharing the detail, like the PowerPoint and the PDF version of it, to Amanda, and she'll be sharing the deck with you just in case if you want to go back and refer some of our notes and stuff. So passwords, there is no question. You need to have password, and those passwords have to follow certain minimum requirements. And then like you need to rotate these passwords every 90 to 180 days. The reason we need to say we are recommending rotating the password is like there is a lot of turnover in the healthcare industry, you like it or not. So somebody who's using your Wi-Fi, they know your Wi-Fi password, and then like let's say they leave and then you haven't updated your Wi-Fi password in years, then they have access. Guess what? They have access to your Wi-Fi network. and then like they could do damage, right? Even reasonably knowledgeable person with all the tools that are available out there on the internet, they can actually just run some quick scanner and figure out how the data architecture is, and then like they can really cause a lot of damages. So the question that comes up most often is, can you use password manager or something to manage all your passwords? So a lot of our customers use password managers. And do we recommend it? Yes, we do recommend it, because for larger organization, it's much easier to handle it than smaller organization, right? So for larger organization, they can store all this information, and then the individuals can use the password managers to log into different application that they have, right? So that is fine, but the password manager, as long as you use the best practices to protect the password manager, then you should be good. Then the second one is antivirus software. A lot of people might be the security professional. If you talk to them, they say antivirus software, they don't really protect you from zero-day attack and stuff, but still it gives you enough protection. So make sure that any devices that you're handling, like meaning you're using to handle patient data, you have some sort of antivirus. Worst case scenario, even the simple Windows Defender is good enough, right? So all this antivirus software, if you know the way it works, so they have a database of all the latest and the greatest virus that is being going out on the internet, or like attacking all the other devices, right? They have the database of it, and they have the fingerprint of those programs. And so what they look for is, whenever you install this antivirus, then they keep looking for this kind of fingerprints across the board within your device, and then if they identify any of them, then they immediately quarantine that program, and then they alert you, right? So that's the way it works at a very high level. And the key thing with antivirus software is the up-to-date database that you have on your antivirus software, the better it is for you. So that's why we have an item to say that you keep it up to date. So you need to make sure that right-click on the icon if you're using Windows, and then figure out what kind of antivirus you're using on the right tray icon, and then make sure that auto update is enabled there, right? If you have IT people who are supporting your environment, make sure that you work in conjunction with them to enable that, so that like you have the greatest and the latest database on your antivirus. So that will actually give you a little bit better protection of your end devices and things. And what we've seen is, in some places, the users turn off the antivirus because the antivirus pops up every time, then they try to download some software and stuff. Make sure that the regular user, the standard users, are not able to turn off the antivirus, right? So you don't give them privilege to turn it off. Only the administrator can turn it off, right? So that will be one good protection mechanism that you could implement with respect to antivirus. So the next one is email. So this is one of the most important, I would say, the security best practice you all need to follow as part of protecting the data, right? So if you take all the any major data breaches, including the DNC hack that happened in 2016, all the way to some of the recent hacks, it all started from somebody sending a phishing email. As you could see here, although it says facebook.com application form, the actual link is not going to Facebook. It goes to some IP address, and they've named it facebook/index.html. So essentially what happens is the phishing email that kind of tricks the normal user to click on a link, which will basically download some payload, they call it in the industry. So it downloads some payload, and then like it essentially gets installed on your device, even without users' knowledge. And then what happens is so then even without user's knowledge, and then what happens is the users any network that they are connected to, it infects the network as well. And that's how like some of these emails, you need to be extremely careful, and we have some best practices that are listed in here. So unless don't click on any URL that are coming in the email. Say even for example, you're getting an email from bank. From a bank, and then like say reset your password. Don't click on that link. Go to the bank's URL directly, and then log in from that link, and then do whatever you are supposed to do. And especially you need to be careful when you are opening attachments. A lot of the emails, they come through with an attachment, and it has got some payload and stuff. So you need to be careful with that. And then again, responding to messages, you need to be careful as well. Then slowly the hackers try to gain your confidence, and then they essentially make you click on some links, and that essentially corrupts your mission and stuff. And also we say like limit sending sensitive data via email. It depends on your company policy. Some of our customers, they totally don't allow any sensitive information sharing via email. Some of our customers, they do allow, but then they do encrypt the data end to end, so it doesn't cause any issues on the way, right? So it all depends, but this is like one of the best practices I think like you all need to think about. So also what we do is like some of our customers, they do have some simulated phishing attacks that we do for our customers to determine where are the weaknesses and what kind of training, additional training that we need to do to customers to protect their workforce. That way, like, they don't act stupid. So that is one on the email side. That's the most important one on the email side. And then the next one is wireless. Of course, like you all know, the vulnerabilities with the wireless. A lot of us, just for the sake of convenience, we connect to some Starbucks wireless or whatnot, and then like we start connecting to our EHR system and whatnots. So you need to be extremely careful when you're using public Wi-Fi. Especially if you're somebody who are using public Wi-Fi to connect to some sensitive applications, what we recommend is enable your multi-factor authentication. So what essentially it does is nobody can spoof your identity only with your password. They need the second form of identification. So multi-factor authentication essentially is whenever, say, for example, you log into Gmail or Microsoft Hotmail from a different location, from a different device, then it immediately sends you a second form of validation, which will be maybe they'll send you some code to your mobile, and then you need to not only give your password to your email account, you also need to use that code. That is time-lapse code. So essentially it expires like maybe every minute or 30 seconds, whatnot, right? So that is something actually you want to keep in mind when you're using the wireless devices and stuff. And then the next one is the mobile device security. Mobile device are pretty common now in the healthcare industry now. Mobile devices are being used by like all the staff, and then so again, like it is prone for theft, right? That's for sure. And then so you want to enable some of those settings so that like you can track your devices. And even if you lose your device, make sure that like if somebody, a third party, wants to access the device, then they need to have some kind of password and other stuff to access the device, right? So enable at least a PIN and the password mechanism for your mobile devices and stuff. Make sure that the data within mobile devices is all encrypted. So most of the mobile devices by default, say for example Apple, they do encrypt your data, and in addition to that, a lot of the Android devices, you could implement additional encryption mechanism and stuff to make sure that the data within the mobile device is protected. So make sure that like you also keep your software up to date within your mobile devices, because any kind of zero-day attack and whatnot, that all happens, if these mobile devices are not up to date and things. A lot of you are using cloud-based applications. Some of you might be using emails. Some of you might be using Box and other type Dropbox and other type of file storage devices and whatnot. So make sure, like even for archiving of images or your backups and stuff. So you definitely might be using cloud-based devices. So make sure you again have all these protections enabled on your cloud-based application. What essentially it means is you have at least not generic ID, you have individual IDs, and you have the MFA, the multi-factor authentication enabled, and also the settings and the sharing options of all your cloud-based devices. Say, for example, some of the files that are out there that could have been shared with the whole world, right? We know, like in Google Drive and stuff, you can keep an option to share it public, right? And that's a big no-no, especially when it comes to sensitive data. That's how all the hackers, they kind of figure out the sensitive information. They just do a random scan on the internet for all these links and stuff. Then they figure out where the data is. So those are like some of the things that you want to keep in mind when you're using cloud-based application. Again, social media, you have to be extremely careful when you are posting any images and stuff on your images, videos, and whatnot on social media. So you need to have explicit permission from your patient if you're posting any of this information, so they can come back and sue you for not having explicit permission. So the disposal, I think we kind of covered that briefly in our earlier discussion. Anytime you're using CD, DVDs, flash drive, and whatnot, make sure the data is completely sanitized when you are disposing of these devices, because that could contain all the sensitive information, and that could come back and haunt you. So emptying the recycle bin is not enough, because like even though you empty the recycle bin, the data is stored in the hard disk. So you need to use the proper methodology to sanitize the data. And then remote working, you like it or not, it's the norm of life now, like especially after post-COVID, right? So you want to make sure that you have good physical security in the place of your work, and then be aware of your surrounding and activities that are going on. And then most of the time, like we recommend that you use VPN to connect to your network, use VPN to connect to your internal network. And especially if you are using cloud-based application, definitely enable your multi-factor authentication, and also make sure that you are setting up session timeout. So this is something that we see a lot with our customers. They don't have any session timeout or anything. Say, for example, you log in to a very critical EHR system and you don't have session timeout, the system is not going to kick you out. And what essentially it means is you step out, things happen. Somebody else, they walk in and they say you are logged into your EHR, and they can cause damage. They can export data and whatnot. So that's why like the session timeout is very, very important. What we also recommend is set it up for about 15 to 30 minutes. I know like it is a nuisance for a lot of you while you are working and trying to parallelize a lot of your other stuff. But still, it is what 15 to 30 minutes is what we recommend for session timeout. That will essentially automatically the session of that particular application should kick you out, and then you need to explicitly log back in. Physical access to all the devices that are storing the sensitive data. That's that the importance of that. Like make sure that like you maintain visitor log. You have all the cameras and other stuff enabled to make sure that like you can go back in time and check what is happening if there was any devices missing. So this is really, really important when you are having your mobile devices everywhere and using a mobile devices to access EHR and the emails and other sensitive data, right? So this could you could very well lose your phone, and then you don't know where it is, and then you are liable for reporting it. So the last one, of course, we all need to plan for the unexpected with all the things that are going on, the crazy weather thing that are going on. Definitely you want to make sure that you create a backup. I cannot emphasize that more. Even in case of a worst ransomware attack, you could very well recover from most of the damages that are caused with ransomware just by having a good backup. What is a good backup? Essentially making sure that the backup would work when you want to restore it, and also the most current backup. Say, for example, you're making changes to your system continuously, especially during work hours, and you need to have backup on an hourly basis or at least on a daily basis, depending on what kind of changes that you are making. So the worst case scenario, let's say you have your recent backup as of yesterday. You go back and restore that backup, and then any data input that you did since this morning, you need to re-enter it. That's pretty much it. So that's the worst case scenario if you have a daily backup, right? If you have hourly backup, then you go back to the last hour. That's pretty much it. So another thing that we see, especially with respect to backup, is people don't include all the applications or all the devices that need to be included in the backup. A lot of times they are processing faxes and other information from a desktop that's on their front desk, and that front desk desktop is never backed up. What happens if it crashes or if it gets affected by ransomware and stuff? That's it, like all their work is gone. And they, we know several cases where the image machine is like got attacked by ransomware, and they don't have a backup of the imaging device. The damage could be pretty big, or also it could be very minimum depending on how well you strategize your backup. I think that's pretty much on the best practices side that I wanted to cover. And then again, I have some tips for administrators and some tips for users. I don't want to go through that individually here. One thing I wanted to stress is make sure that you do security awareness training to all your staff regularly. There is nothing like the training return on investment for business owners, because a dumb user could cause a lot of damage. At the same time, like if you have a very knowledgeable user, you are going to prevent a lot of issues right at the beginning. So make sure that like you provide good training to the staff and the best practices that they need to use and stuff. And so I have a few more slides on the best practices for handling data breaches in terms of how to identify the data breach and how to respond and stuff. So I'll go through that quickly. I know like I'm running out of time, and just give me a couple more minutes. So if you want to know, if everybody, this is applicable for anyone in your organization, not just for the business owners or not just for the administrator, right? Anyone who is using the computers, they need to keep on looking at some of this thing. So if you are trying to access a particular application and you are not getting access, then you need to take it to the next level in terms of reporting it, escalating it to the right people. And if your network is suddenly slow, then you need to find out what is going on. It could be some activity that's going on by the hackers, right? So you need to be careful. And then this is for the administrator. The third point is if they are looking at a lot of activities in the system logs, again, they need to be careful. If some customer is calling you saying that, hey, by the way, I gave my credit card information to your front desk on the other day, and then like I got some alert from the credit card company, that means somebody has got access to your systems. And then like if you are missing any devices, these days, like these devices are really, really small in size, right? So you cannot even notice that. That's why we recommend that you maintain a good inventory of all these electronic devices. Say, for example, flash drive or your backup drive and whatnot. So if they are missing, if they are not under anyone's custody, then that's a big deal. You might be storing a lot of information in there. So that could also be a symptom for data breach. So if your web page, if that is messed up, then that means you potentially could be having a data breach. And then if you are getting a lot of spam emails, that is another sign. And then also look at like some of the other things. If you are seeing some, this is the last one is for the administrator. If you are seeing some suspicious or unusual login activities, maybe some off hours and location and other stuff, then that means potentially somebody knows your password, critical system password and stuff. Also check out the leading causes of healthcare data breaches. I think some of the sources that we shared, it will give you more idea in terms of what are the things that could go wrong and how can you avoid it. As they say, like, you learn from others' mistake, you look like very, very smart person in the room, right? And then what do you do if you suspect a breach? Most of you should have a designated security officer. If not, this is time for you to designate somebody who's going to be your security officer. And then you need to inform your security officer if something happens, because they are trained specifically on how to handle the data breaches and stuff. Most of the time, you can leave the device as is. Like what we recommend is just unplug that from the internet and just leave the device as is, because that helps to maintain the original copies of the things. That helps with the forensic examination and whatnot, right? So, for example, if the issue is really severe, if there are nation state actors involved, then obviously it might be escalated to FBI level, and then that time, like the device as such is going to be very helpful, without restarting the device or without resetting all the data in it and stuff. Notify media is required, so I think like we talked about some of the requirements and other stuff with that. This is again like the best practice. Don't ignore. If you are seeing some of the symptoms that we discussed in the earlier slides, don't ignore that, report that, and don't shut down the system. We want to isolate it, so unplug that from the internet. If it is connected via wireless, then just disconnect it from the wireless. Don't auto connect. That's pretty much you need to do. And then don't delay reporting. Time is critical. Time is of essence. Report it immediately. And then don't disrupt business continuity. That is essentially, healthcare being in a very critical sector of the business. So you need to make sure that you are continue to provide patient service and care to the patients. So you could probably switch back to your paper-based records or some temporary arrangement your practice may have, but still think about having the continuous business continuity. So there are a lot of information available out there if you want to, equip yourself with some of the things that we discussed about. So we have the URLs here published for your additional references. So some of the key takeaways, just to wrap up, audits are happening by the government agencies. So you want to not only comply for the sake of compliance, and also you want to protect that data. And then, so whenever you are doing any of this exercise that we discussed earlier, sensitive data should be the focus of your exercise, and you don't want to protect something, where you don't have any data, right? Sensitive data, right? So, and also you want to focus where the sensitive data is, and not everything, right? So that's one. And then minimum necessary, I cannot emphasize that one also more. If you don't need the data, don't collect it from the patient. First of all, whenever I go to doctor's office, looking at their form, just laugh at it, and 90% of the data that they collect from us, they don't even use it. So you want to make sure that you collect that, you reformat all your forms, and make sure that you collect only the information that you need. And so there is no silver bullet, especially when it comes to preventing data breaches and protecting patient data. It's like kind of a continuous journey, and you need to be assessing regularly. You need to be training your staff, and you need to be implementing all these best practices and stuff. So that pretty much wraps up what I wanted to cover. Sorry, Amanda, I ran over a little bit. Hopefully, most of the audience got like what they wanted, or like I think, like you said, like we have some Q&A time as well.
We do. So thank you so much, Srini, for going over all of that information with us. That was really helpful, and a lot of things for our viewers to think about and to be mindful of. So let me just share my screen. If anybody has any questions, like I mentioned before, that box on the right side of your screen, there is a little arrow at the top. If you have that collapse, you can click on that arrow to open it back up. And there is a section called questions. If you type a question into that box, we will go ahead and take that now. We can have Srini answer that question for you before we log off. So if anybody does, please go ahead and type in that box now. We cannot hear you as everybody viewing is now muted. All right, so I'm just looking out for any questions from you guys. We also had a few poll questions. Srini, did you want me to go ahead and send those out?
Sure.
All right, so everybody, you're going to just take a look at your screen. You're going to see some really quick poll questions popping up. This is going to give us some information that we could use. They're really quick, just yes or no. Click if you could just take the time to do that for us really fast. Go ahead and launch these. And give you guys a minute to go ahead and ask questions too while we're doing this. We've got some nice comments, good info, very informative. All right. Go ahead and launch. Let's see. I'm sending out these poll questions to you guys, and then just giving you an opportunity again to type in the questions box if you guys have any. That was a great webinar. I know that was a lot of information. It came across really clear to me and informative. But if you guys don't have any questions that you can think of right now, and you think of anything in the future, please do remember that you can reach out to Srini over at Databrackets. Their website is databrackets.com. And if you have any questions for us over here at Patagonia Health, you can also reach out to us to find out more about our secure electronic health records and billing solutions. And our website is patagoniahealth.com. I've just got one more quick poll question for you guys, if you want to take a minute to answer that. Well, Srini, it doesn't look like we have any questions right now. That must mean you just did such a fabulous job of giving all this information. Nobody thought of anything that you didn't cover. But again, everybody, just do reach out to Srini if you have any questions after the webinar. As he had mentioned, we're also going to be sending this information out so you guys can view this again and be sure to get all the information that you wanted. Thank you so much for joining us today, Srini, and taking the time to go through all this information with us. We really appreciate that.
Thanks, Amanda. Thanks for the opportunity, and thanks, everyone.
All right, everybody. So we're going to go ahead and close it out now, but thanks so much, and we'll hope to see you at a future webinar in the near future. Have a great rest of your day.